Hello again, it's me, Sarah Beth Gerard Summers, and right now we're going to talk about surface anatomy. However, we're going to stay focused on the antebrachial and manus regions. Antebrachial and manus regions. Now, in this video, we will literally touch on physical landmarks and explain their importance in the clinical setting. So, let's get physical, and examine our radial styloid process. I'm sorry. The radial styloid process is the projection of the lateral surface on our distal radius bone. Now, I am not sheer. I'm very pale, but I am not Casper clear. So I had to use my artistic-ish abilities to create a masterpiece for you. Now, if we're talking about our radial styloid process, it's the projection on the lateral surface of our distal radius bone. The tendon of the brachioradialis, which you thankfully can't see, attaches at the base, while the radial collateral ligament of the wrist attaches at the apex. Now, if we're talking clinical importance, or just importance in general, it's important to know where the radius is. And the way that I remember it is, and this does tell my age, the radius is rad. Rad radius. But clinically, it's important to know where the radius is because if it gets injured, you need to know. For example, if there's pain on the outside of the olecranon, if there's swelling on the joint, if one has difficulty bending or flexing or straightening or even turning the forearm in supination, you've potentially broken or injured your radius. But this forearm is not all about the radius. All about that radius, about that radius. No, there's the ulna. So moving on to the ulna, or this guy. While the radius is technically the larger joint, the ulna is just as important. Its rounded posterior forms that bump in our elbow, anatomically known as the olecranon. The ulna is also the attachment site for the triceps brachii, the anachronous, and the flexor carpi ulnaris muscle. It articulates inferiorly with the ulnar notch of the radius, down here, when pronating and supinating the forearm, wrist, and hand. Now clinically, the ulna can be damaged in a fall. If you stumble and instinctively attempt to brace yourself to avoid hitting your head, and you forcefully hit your manus in an attempt to stabilize, if your fourth and fifth digits hit first, the pressure is caught by the ulna. If you begin to feel ulnar-sided wrist pain when pronated, it could indicate a fracture in the ulna's base. Thank you for listening to All About Our Surface Anatomy. Again, this is Sarah Beth Gerard Summers, the incredible artist, and I hope that I helped you a little bit in understanding further. Have a great night.